Hello, welcome to our channel. We would like to say, you will motivate us to make more and better videos about the relationship between nutrients, medication and diseases by subscribing our channel. And, you will contribute to increase the knowledge of others by sharing them. We appreciate you in advance. This video is about a scary connection between snoring, dementia, and heart stroke. Heavy snoring is no joke. Why? Snoring is often a sign of obstructive sleep apnea. In obstructive sleep apnea, breathing is stopped for 10 to 20 seconds while sleeping from a few to hundreds of times a night. Snoring doesn't happen in every case of sleep apnea, but anyone who snores should consider obstructive sleep apnea. Based on a study published in the journal Neurology in 2015, any disruption of breathing during sleep can affect the brain. People with sleep apnea tended to develop memory problems and mild cognitive impairment about 12 years earlier than those without such sleep disorders. Mild cognitive impairment, or MCI, often precedes Alzheimer's dementia, but not all people who develop MCI go on to get Alzheimer's. All snoring is not a precursor to memory problems or Alzheimer's, however, particularly in the elderly, disrupted breathing during sleep can have a potential effect on the brain. Although it is not clear how sleep disorders might increase the risk of mild cognitive impairment or Alzheimer's, two mechanisms have been suggested. One. When a person isn't breathing, even for short periods, its cumulative effects deprive brain neurons of critical oxygen. 2. Other studies have also shown that the protein responsible for damaging nerves and causing Alzheimer's, called beta-amyloid, can build up during the day when the nerves are active. Beta-amyloids decline at night during deep sleep. Importantly, if a person is being roused from a deep sleep by apnea or snoring, the reduction of beta-amyloid production is disrupted, and it can build up and potentially form beta-amyloid plaques, leading to Alzheimer's. Those with obstructive sleep apnea, even without snoring, face an elevated risk of cardiovascular disease. There are chemicals in the brain whose job is to trigger breathing, and these can fail in some people who snore. As a result, oxygen levels drop dramatically, causing cortisone, adrenaline and other hormones to surge. These hormones contribute to high blood pressure and heart irregularities and can cause or exacerbate heart failure, triggering heart attacks. Even without snoring, people with obstructive sleep apnea have reduced oxygen in their system, which damages the heart. Patients with heart failure are highly likely to have sleep apnea, which worsens heart failure and reduces the heart's pumping function. Considerably, the risk of MCI or Alzheimer's in snoring people treated by different ways, like using a device to prevent apnea, known as a continuous positive airway pressure or CPAP machine, is in a normal rate. Treatment with CPAP can improve the heart pumping function by as much as 50%. Actually, CPAP machine keeps airways open during sleep. In conclusion, if you snore a lot and suffer from obstructive sleep apnea, take it serious and follow the treatment to prevent heart failure and Alzheimer's. If you would like to see the references used, check the video's description. Please don't forget to subscribe. Thank you.